Good morning and welcome to the City of Toronto Media COVID-19 media briefing on November 30th. First up, we have Mayor John Tory. Go ahead.
Well, good morning and thank you, Lavin. We wanted to provide an update this morning on the work being done in response to the Omicron variant. The city's strategic command team, which has helped to manage throughout the pandemic, met on Sunday morning and again this morning to discuss the variant along with the city's overall ongoing response to the pandemic. Right now, we have more questions than answers around the variant, very similar to what we heard yesterday from provincial officials. At this point, our city public health officials are monitoring the situation. They recommend continuing our current cautious approach, and we support the swift actions taken by the provincial and federal governments in this area. We are preparing to expand Team Toronto capacity as needed for booster shots, if and when eligibility for third doses is expanded by the province, and we're preparing our VaxTO campaign to do further outreach as needed. The bottom line message remains the same as we have been delivering for almost a year now. The best protection against this virus and any variants is to get fully vaccinated. Our public health officials and all the science is very clear. If you're not fully vaccinated right now, this is the time to get fully vaccinated. We are making great progress on helping residents to get vaccinated, including our younger residents, and helping eligible Torontonians to get their third doses in applicable cases. Just a week after the vaccine for children arrived, our Team Toronto Kids COVID-19 vaccination plan has helped more than 21,536 kids ages 5 to 11 to get vaccinated. That's 10% of all kids aged 5 to 11 in our city, and this is a super start with much more work to be done. Vaccination of people 12 and older is also continuing. 85.7% of residents 12 and older are now fully vaccinated, meaning 2 doses, and more than 89% of residents 12 and older have at least 1 dose of COVID-19 vaccine. We are less than 1% away from more than 90% of residents 12 plus having at least 1 dose. It's just 23,000 people that we have to get their first dose in the coming days to get us to the 90% for first dose. And 116,000 people need to get second doses now for us to reach the 90% goal in that important area. In total, almost 70,000 doses of COVID-19 vaccine were administered by Team Toronto in the last week, largely due to the arrival of the kids' vaccine and the growing number of people eligible for a third dose. But these numbers indicate, I think, that progress is continuing at the pace we expected at this stage of what has been a historic and very successful vaccination campaign. To continue our vaccination efforts at this important time, I'm proud to announce today that we'll be extending the work of our community immunization engagement and mobilization teams to June, which is a 6-month extension. Our outreach teams have helped us a great deal to connect to residents across the city in every neighborhood, but especially those who might otherwise have been left out or who face some obstacles or hesitation with respect to getting vaccinated. These teams have been doing wonderful work to help us to achieve the numbers we have, especially with those who might have not found it as easy to get vaccinated. These teams are a key part of the Team Toronto approach and have engaged with more than 800,000 community members since April of 2021. Providing them with trusted vaccine information and encouragement. 400 ambassadors have literally gone door to door, and these are some of the people that we'll be extending for an additional 6-month period. They've talked to people in lobbies of apartment buildings, in parks, in shopping centers. They've met people where they are. They've done it in dozens of languages with creative approaches to connecting with people and by gaining well-earned trust with residents, all to lead people to an informed decision to get vaccinated. This $6 million extension, funded by the Government of Ontario, is a further investment in our outreach efforts, and it will make sure that we continue to help communities with the lowest vaccine rates, help families in these communities to get their kids vaccinated, and make sure that we help residents to get their booster doses when they are eligible. We are just at the beginning of the kids' vaccine campaign and the booster shot drive, but this extension will ensure that we have the resources we need for the last miles of this marathon. I know these past 20 months haven't been easy. That is why I'm so determined to make sure that the progress we have made continues on all fronts. While we're continuing to monitor Omicron, we are also proceeding cautiously with the reopening that is well underway. I believe it is important, based on the information we have at this time, to continue to make progress on that reopening while at the same time respecting public health advice and monitoring on a continuous basis. As the largest city in Canada and fourth largest in North America, Toronto has one of the highest fully vaccinated rates for its entire population. Omicron will not take our focus from leading Toronto's recovery from this pandemic. My goal as mayor is very simple, which is stronger than ever. You've heard me repeating that, and that is the goal, to have Toronto emerge stronger than ever in every respect. I am absolutely determined that Canada's economic engine, our city, and that economic engine part has to do not just with the prosperity of the country, but the well-being of the residents who need to be employed and earning an income and back at work. I want the city to come back stronger than ever in that respect. The city was booming before the COVID-19 pandemic began, and I want that boom to continue, just as I want it to represent an opportunity for every single resident of the City of Toronto without exception. That is why I've continued to work hard during the pandemic to attract companies and jobs to our cities. We've done a lot of it virtually, as you've done much of what you do each and every day during that time. And we've also been working hard to secure much-needed supports for our residents and for our businesses from the federal and provincial governments who delivered for us. And that's why I've been working relentlessly as well with the Toronto Region Board of Trade and with major employers, excuse me, on the need to help downtown in particular, but all employers across the city, by creating the kinds of conditions that can permit a safe return to work. This is an area where I believe, and I'm strongly determined to see that the Toronto City Hall and the City of Toronto itself leads by example. Throughout the pandemic, more than 75% of City of Toronto employees have been coming into work without a work-from-home option. They've done an outstanding job, and that is why they were able to maintain the services that you rely on as people who live and work in our city. Around 25% of our workforce, who work mainly in offices here at City Hall and in buildings around the city, have been able to continue to do their work from home, not unlike the majority of the downtown workforce. Today, I'm announcing that all city office buildings will soon reopen to employees at maximum capacity within the context of public health requirements. We will continue to comply with public health requirements and provincial physical distancing requirements, but we are now focused on the maximum, not trying to maintain the minimum. Every City of Toronto office building will be open to the maximum occupancy possible under the rules, and that will increase automatically as the pandemic recedes and as physical distancing requirements in workplaces are modified by the provincial government. Today, I am also announcing that City Hall and all of our civic centres will be reopening to the public on January the 4th, 2022. This timeline will allow for proper notification of our employees. At City Hall, this will mean the public will be able to access the main floor rotunda, washrooms, library, and counter services on the first floor, and attend scheduled meetings with me, with councillors, and with our team members. The counters themselves have been open with a safety protocol in place since the summer, and it has worked well. But we will now look to increase services at those counters and send a clear message that City Hall will be open for business as of that time. The digital options for counter services rolled out during the pandemic will also remain in place so that people can access both in person and online. Opening city buildings to the community in a safe and responsible manner is another major step forward in helping Toronto return to a more active and thriving city. With our own offices opening up to maximum capacity, we will also be welcoming our remaining office staff back on January the 4th, 2022. Again, like many other workers, they have mainly been working remotely. I believe this is an important signal to other workplaces in both the private and public sectors that we can safely return and reinvigorate the economy and the downtown core in the process, and do so safely. While many staff will still have the ability to work remotely, and that is now part of our accelerated plan to reduce our office costs and save taxpayers' dollars, we are anticipating that most will be in the office at least 3 days a week by January the 4th. This is part of a careful plan that will be carefully implemented. Also recognizing, for example, the extraordinary vaccination levels achieved by our employees, our plans require notice to our employees and will be engaged in our customary daily discussion of prevailing circumstances as we go about implementing this plan. I know that many employers have begun returning staff to work in the core, and many others are preparing to do so in January. Now is the time to begin, in a safe and responsible manner, to return people to work in the office, especially in our core, and that includes right here at our City Hall. Council and committee meetings will follow suit as we return to meeting in person in January, with an option for members to participate virtually if they wish to do so. If and when physical distancing measures are further lifted in the new year, we will welcome the public back to in-person council and committee meetings. It is my hope that this announcement inspires other businesses and employers to follow this example and to do the same, again in a careful, safe, and responsible manner, subject to ongoing monitoring, and to help their staff get back to workplaces and show that Toronto is indeed going to be open for business once again, safely and responsibly. By reopening our buildings and bringing our fully vaccinated office staff back, the City of Toronto is leading by example and encouraging other employers to do the same. It is the right thing to do with the information we have available right now and with the continuous daily monitoring we will be doing going forward. Our progress getting people vaccinated across the city, including the outstanding progress we have made with our own workforce, has been something that has made this possible. Our mandatory vaccine policy has ensured almost 100% of our employees are fully vaccinated. We will be complying strictly with all other public health guidelines, including, as mentioned, physical distancing inside our work premises. City Manager Chris Murray will be conveying this message to employees over the coming days, and he'll have something more to say about that in a moment or two, while stressing that we will continue to monitor the pandemic situation, as we have been doing in any event, on a day-to-day basis, and we will adjust as required. I am confident that this safe and responsible return to the office at City Hall and at major employers over the coming months and coming weeks will help ensure that Toronto comes back stronger than ever, and that is going to be good for all people, including those who need supports from us. We need to come back stronger than ever so that we can be prosperous as a city, so we in turn can reinvest that into supporting people who need help in our city. I will now ask Dr. Davila to offer her remarks for today.
Thank you, Mayor Tory, and good morning. Last Friday, the World Health Organization designated the new COVID-19 variant Omicron, recently detected and identified in South Africa, a variant of concern. Like governments, scientists, and public health specialists around the world, in Toronto, we are grateful to the South African government and its scientists who have openly communicated about this new variant. This speaks to the level of collaboration and global information sharing about the virus. This degree of worldwide cooperation is reassuring and demonstrates that the system to monitor virus activity is working. As South African scientists and other experts in the field have communicated, more study is necessary to fully understand what the implications of this new variant might be. I appreciate that the idea of a new COVID-19 variant, or the words viral mutation, may sound concerning. However, it is important that in general, we must remember that viruses mutate as a matter of course. And it's true that the Omicron variant contains mutations that are associated with increased transmissibility in previously identified COVID-19 variants, and that there are also mutations on Omicron that are associated with some degree of immune escape. However, to more fully comprehend the Omicron variant, clinical observation of real-life experience around the world is needed over the next few weeks. As this proceeds, and as we monitor carefully, it is important to remember just how far we've come since January 2020 in terms of understanding COVID-19. We know now how it's transmitted. We know more about how to treat it. And we have effective vaccines. While we await the results of scientific study of Omicron, and as we move towards the winter holiday season, there are two messages that I wish to convey to you today. First, vaccine makes a difference. And so far, vaccines have proven effective, including right here in Toronto. In fact, analysis done by our epidemiology team at Toronto Public Health shows that this year, from August 1st to November 6th, across all neighborhoods in Toronto, for every 10% increase in vaccination coverage, there was a 7% decrease in the incidence of cases of COVID-19. In addition, local data show that of the total number of Toronto residents who are vaccinated, only 0.17% became infected with COVID-19 after they were fully vaccinated with 2 doses. That's 3,936 cases amongst the 2,288,445 people after they were fully vaccinated with 2 doses here in Toronto. In other words, breakthrough infections are rare. What this all adds up to is this: vaccination continues to be one of the most important actions we can take, and that we can encourage others to take as well. The second message I want to provide to you today is that all the measures that have protected us to date continue to be important in light of Omicron and as we seek to connect over the holiday season. Specifically, we need to remember that we have several tools at our disposal to help protect our households, our families and friends, our schools, and our community from COVID-19. Mask while indoors. Keep your in-person social circle small and limit it to vaccinated individuals as much as possible. Wash your hands. Practice physical distancing. Stay home when you're sick. Encourage your workplace or community group to develop a vaccination policy. If you operate a workplace or someone who's responsible for a community group or setting, please continue to keep records of in-person attendees or visitors. This will help to facilitate public health follow-up should a COVID-19 case be detected. We will see more cases of the Omicron variant detected in the future. It is not a question of if, but a question of when. And it bears repeating. Viruses mutate as a part of their regular course. But we also know this: the more we are able to reduce transmission, the less likely it is that new variants will emerge. Vaccines remain safe, effective, and necessary to help bring the COVID-19 pandemic to an end. The best action you can take today, if you were born in 2016 or earlier, is to get fully vaccinated. And for those of you who are eligible for a 3rd dose, I encourage you to get yours as soon as possible. Vaccination, coupled with public health measures that we know reduce transmission, regardless of what variant we face, remain the best tools at our disposal. With that, I'll now hand it over to City Manager Chris Murray.
Thank you very much, Mayor Tory and Dr. Davila. The Toronto Public Service is putting a tremendous amount of effort into recovery from the pandemic and reopening all city buildings that were closed to the public due to the pandemic on January 4th, as Mayor Tory has indicated. This, of course, includes City Hall, Metro Hall, and all of our civic centers. This is a really important and exciting time for all of us. We are also very pleased to welcome more members of the public back to this important place of work. Throughout the pandemic, City of Toronto staff have continued to keep the city running with the same care and quality we always have. And it is the same time we found new and creative ways to serve residents and businesses. My sincere thanks and appreciation go out to the vast majority of city staff, over 75%, that have been working at various locations across the city throughout the entire pandemic. These dedicated staff have delivered essential and critical services throughout. from your drinking water and emergency responders to shelter and long-term care facilities. This is the backbone of the public service. Now, our dedicated office staff, who have been working remotely, yet tirelessly, will continue their return. These staff represent 25% of our workforce, and having them back in city workplaces 3 days a week at a minimum is exciting news for all of us. It means a renewed focus on workplace culture and enjoying the benefits of collaborating in person. As city manager, I am immensely proud of all the hard work of the Toronto Public Service to get us to this point today. As the mayor has already said, opening city buildings to the community in a safe and responsible manner is another step forward in helping Toronto return to a more active and thriving city. Ongoing monitoring of the public health situation is, of course, something we do every day and take extremely seriously. It has been the case since the start of the pandemic. Any decisions we make will continue to be guided by science, and should the situation change based on science and evidence, we'll adapt as required. Since early August, when we first opened city counters for in-person services, we have seen more than 45,000 visitors to our buildings, with 75% of those being walk-ins. I am personally glad to be working in person with colleagues, reopening buildings to a maximum capacity so we can welcome even more visitors, and of course attending council meetings in person and getting back to the Toronto we all know and love. Thank you.
Thank you, Mayor Tory, Dr. Davila, and Chris Murray. We will now take questions from the media. As a reminder, it's one question, one follow-up, and we will unmute you when we say your name. First up, we have Sina from CBC. Go ahead.
Thank you. My question is for Mayor Tory. I understand that today is the deadline for Toronto police officers to disclose their vaccine status. As a board member, do you think it's important for officers to be vaccinated? Do you expect this deadline to impact police services?
I just didn't catch the very last part. Do I expect that this deadline will be?
This deadline will impact the police services.
Well, first of all, I think it's important for every single Torontonian to get vaccinated, whether they're police officers or in any other line of work, and whether they're young or old, within the guidelines obviously put out by the health officials. And I want to just say that I think the efforts that have been made by the police service, the members of the police service, and by the members of our own public service, they're permitting us to carry on safely with all the work that we have to do for the public, and to make sure people are safe on the job and make sure that they're safe in their interactions with the public. And the police have commented themselves on their own numbers and will continue to do so, but I will just say that I'm very gratified at the fact that they have become vaccinated in such large numbers, and that we've had their cooperation within the context of the vaccine mandates to get vaccinated and move forward, and that the policy that they put forward, I as a member of the police board participated in putting forward for our police officers, will continue to apply, and it will comply within the applicable legislation. And I think that will be good for Toronto and good for health, both inside the police service itself and also in their interactions with the public.
Follow-up?
My second question is, the General Licensing Committee is meeting today to discuss ride sharing. So cab services like Uber want the city to allow drivers licenses, but the city has put a stop on issuing ride sharing licenses until the driver training accreditation program is developed. There are concerns that this may leave many unemployed, especially at a time when people are still trying to recover from the economic losses and pandemic. And with the holiday season approaching, they say there is a need for more drivers to prevent incidents of drunk driving. What are your comments on that?
Well, let's be clear that safety always comes first, and that, yes, of course, applies to people not driving cars when they've been consuming alcohol, but it also applies to making sure that people who are driving others for a living, in other words, in vehicles for hire, taxis or Uber and other such cars, are properly trained. And I think the City Council felt, and I supported other members in expressing this view, that we had quite a substantial delay in moving forward with the kinds of training that people could be assured would produce the maximum amount of safety on the roads. And so now people are proceeding apace at the City Hall here with moving forward on that training. There's a competition out to get people to provide the training. Everybody's moving expeditiously to actually have that happen. And I think that's the right thing to do. And there are still thousands upon thousands of people out there, taxi drivers and others, who will be able to provide these services. And the faster we can get the training underway, the faster we'll be in a position to be able to accept the issuance of licenses again. So I think the objective is to get the issuance of licenses going again, but to do that concurrent with the kind of training that we expect to see as a means of keeping the public and the drivers safe.
Thank you. Next up, we have David Ryder from the Star. Go ahead.
Hi there. First question could be for actually all three, I think, is that given the uncertainty about this new variant, why push ahead with a January 4th return of city workers and opening, having the public mingle with them, inviting them into city places? Was there thought to putting it on hold? Because what happens if we find out that it's more deadly than Delta, and the city has a role in causing people to be put in harm's way?
Well, I will start, and my colleagues will follow along as they wish to do. We had to have a plan, and a plan requires a date, and a plan that is sufficiently far ahead to give our employees notice of what was going to be expected and to get the buildings ready for people to come back was one that, in this case, has more than a month before the date of implementation announced today. And in that period of time, between now and then, we will continue to implement the plan carefully and responsibly, but we'll be watching every single day as we do. We discuss these numbers and all the prevailing circumstances and all the trends and all the developments pretty much every day, and that will be all taken into account in moving forward with the implementation of this plan. At no time would we ever consider doing anything that was contrary to the best interests of the health of our own employees. But we have a dividend here that is paid by the fact that we have almost 100% of them vaccinated. And if we can bring them back to work safely, as we believe we can, because we've had continuous advice from public health with respect to the implications of bringing them back, then we will proceed with this plan. And so I think that is really what I think is at the core of this, which is a careful and responsible plan that has to have a date in it. And we say the same to other employers out there. And I know from my own contact through the Board of Trade and directly that many, many employers are planning to have people come back to work in January at the same time on more or less the same conditions, and obviously in their case as well subject to continuous monitoring, including with us, as to the prevailing health circumstances. None of us will ever do anything that would put our employees at risk or the broader public health at risk.
If I can, I'd just like to say this, as I think Mayor Tory has indicated. I mean, this is like everything that we've done from day one in the pandemic has all been a measured approach. And yes, having a plan, I think it's important to staff to give them as much advance notice of how the return to work here at City Hall is unfolded. We talked back in August about opening up counters and make it voluntary from September until the end of October to return. We then said from November to the end of December that it'd be up to really management to decide who would have to come in over that period of time. And I think it was clear to people that starting in January, we'd be more declarative. Now, to the mayor's comment, absolutely, safety is paramount. So yes, the vaccine has gone quite well with public servants. As well, all the measures that Dr. Davila has talked about are all in place, in fact, have been in place for a long time. So restrictions in terms of washrooms and elevators and space where people work in, and washing of hands and all the disinfectants that we need. So we would never put our staff in a situation that wouldn't be safe. And if the evidence does present itself that causes us to change course, of course we will do that and give staff certainly as much advance notice on that change, of course. So again, a measured approach as we've been doing all along.
So I think you've heard quite a comprehensive answer from both the mayor and the city manager. The only note I can add from a public health perspective is exactly as the mayor said. We are in constant communication. We are regularly monitoring the situation. And further to the city manager's point, should the situation change, should the circumstances change, I know that we will be discussing that and then taking the appropriate course of action in concert with the data we have on the ground and the best available science. This is what we've done over the course of the entire pandemic, and I can assure you, you can count on us to continue to do that throughout the rest.
Thank you. My follow-up, I think, is specifically for Dr. Davila, and that's the Omicron variant that everybody is talking about and studying. We've seen, I think the last I heard was 4 cases in and around Ottawa from travelers who had returned. Is it a matter of time before it's in Toronto, given the international nature of the city and how we saw Delta and other things often pop up here before spreading to the rest of Ontario? Whether or not it's going to be as serious as some people fear, or hopefully not, is it just kind of any day now that we're going to see some tests show it here in Toronto?
Well, David, I think you've already alluded to the answer to the question. We are an extremely global city. We have seen cases already in Ontario, as you rightfully pointed out, cases in the Ottawa area, and it's my understanding that there may be others that are being worked up around the province as well, and likely around the rest of the country. This has been replicated in jurisdictions the world over. So, as I mentioned in my remarks, this is, to my mind, a question of when, not if. That being said, we have a lot of strengths in our favor. As you've just heard, we have relentlessly pursued an approach consistent with the available data and evidence and the best available science. We have seen really unprecedented levels of global cooperation and collaboration and information sharing, so that we are able to take the best course of action, as informed as we can be by the best available science that's out there. And I think here in this city, we've demonstrated over and over again over the course of the pandemic that we are following public health measures. I see incredible use of masks. Here we have a really well-developed access to testing and surveillance mechanisms. And of course, we should be very proud of the levels of vaccination coverage we have achieved to date. We are certainly the highest when I look at large cities across North America, and we rival those the world over. So that doesn't mean we should rest on our laurels. On the contrary, we should be continuing to be vigilant in all of these respects, in all of these aspects, practicing those public health measures, masking, physical distancing, limiting your interactions to those who are vaccinated, and keeping your social circles small where possible. All of these things, along with vaccination, continuing to push vaccination and to get that protective benefit out there to as many people as possible, all of that taken together, I think will continue to see us in good stead.
Okay, next up we have Mark McAllister from City News. Go ahead. Mark?
Good morning.
Oh.
I think most of my questions have been answered. I'm just wondering if, I know on Friday there was a release with regard to the number of staff members who have been placed on unpaid leaves of absence. I'm just wondering if you have an update on.
Thanks for the question, Mark. As we do every week on Fridays is when we provide the update, so we will do that in due course again on Friday. So I don't have today exact number in terms of leave, but we will report on that as I indicated.
That's all the questions I have. Thank you.
Thank you. That's it for today, everybody. Thank you and have a great Tuesday.
Thank you.
Thank you.